Alrighty. So, hello, Miss Jennifer. My name is Anamika, and I will be your student nurse today. I wanted to assess your cultural background and your view, how that affects your views on healthcare. So, I'll be going forward with that. Thank you for participating in this interview. And do you have any questions before we start?
No, I don't think so.
Okay, well, I have plenty of questions for you.
Okay.
So, could you tell me a little bit about yourself?
Yes, my name is Jennifer Saj. I am in grad school to become an occupational therapist. I'm in my third year and graduate in May. I was born in India, South India, and I moved to the US when I was 2. Um, Moved to Philadelphia at first, but then to Georgia, and grew up most of my life in a pretty rural, mostly white area. Um, My parents are from India, my grandparents are from India. They speak Malayalam. I speak English, so usually I speak English to them, and then they will respond in Malayalam.
Okay. And when you speak to like elders in your family, like what kind of, do you have any like special words that you call them?
Yeah, so if someone is older than us, um, if they have kids, then we say auntie or uncle. If they don't have kids, we'll say like achachin or chechi, which means like older brother, older sister. But yeah, usually attach that to the end of the name, even if they're not related to you.
Okay. And then how about like your peers? Would you also speak formally with them or
Um,
informally?
if they're the same age, then no. Sometimes if if they're even if they're older than you, then you would still attach like the respectful like um yeah, the word that after their name.
Okay. And so can you describe your home life a little bit? Like what kind of family structure? Do you live with multi-generations or do you it's just single family?
Yeah, right now I just live with my mom. She's the only one in her family that's here because my grandparents are still in India. So just her and then my siblings all live by themselves in other states.
Right. And is that like typical of your culture to live with parents or grandparents?
Yeah, I'm 26 now, so I guess even if I get to like 30, I would still live with my mom if I was unmarried, I guess, which is normal in our
Mhm.
culture.
Okay.
My grandparents live with their son and his family.
All right. And what religion do you practice, if any?
I am Christian.
And so how does like your culture have to do with like jobs that you've worked or that are like acceptable
Hmm,
or seen as like successful?
yeah, definitely. I think jobs that require you to get a high degree of education are seen as more successful, or jobs where it's like you make money through the 9 to 5 way. Like, I guess the
Mhm.
ones that people look down on would be like doing like side hustles or stuff. Like, even if you're making a lot of money, like people wouldn't really respect it as much as like if you got it like 9 to 5 or had a higher education.
Okay. And so what's like the view of money? Would you say the view of money in your culture isn't as important as like the level of education?
I think in my state specifically, education is definitely what's valued. Money is still important, but from what I've seen from like other people from my state, is
Mhm.
that they'll go get a education even if it doesn't mean that they'll necessarily get a like high paying job with it.
Okay. And in your culture, what is kind of the view of relationships? I know you said before that like you would continue living with your mother until you got married. So is that like
Yeah,
what's how does that work with your culture?
that's pretty common for the state I'm from, which is
Mhm.
Kerala.
Okay.
So like dating isn't like you wouldn't tell your parents that you're dating unless you're
Okay.
planning to get married to them. Um,
Mhm.
yeah, sneaking around would probably be common because you just wouldn't tell your parents about it. Otherwise, they'd be planning your wedding once they heard that you're dating someone.
Okay. And like what's the kind of view of marriage? Is that
Yeah, it's kind
um
of like something that,
Like everybody does.
yeah, like they expect it, like it's the they view marriage as when your life begins and like as you become an adult when you get married.
Mhm.
So like even if you have a job, it's like, oh, but you need to get married.
Okay. Um, and okay. So what about naming? Do the children like when they're born? I know that you're Christian, so is there a certain pattern, or is like mix of Indian names with Christian names?
I will most of the time, like most Christians who are live in Kerala do get biblical names.
Mhm.
Um, I didn't. I don't know why. They were just like, oh, Jennifer. There's a lot of celebrities named Jennifer. We'll name it that. Which I guess since
Mhm.
it was like an American sounding name, they considered it. I don't know. Like there is a lot of American sounding names in Kerala.
Okay.
I guess it's not always biblical, but most of the time it's biblical names.
All right. And then in your culture, how do you kind of view time?
Um,
Like punctuality, getting to places? Are you
most
like always late and that's
people,
acceptable?
yeah, most people I in from Kerala are pretty like lax about time. Like if they say the party starts at 5, people can show up at 6, and no one really cares that much. Or it's not really seen as rude. It's just like, yeah, we're all going to show up late.
Okay. All right. So what is like your worldview of health?
Um, for me, I guess it's been kind of shaped a lot by just my career path, but I see it as kind of like a holistic view, like not just the physical health and the physical body, but like mental health and like every aspect of your life kind of relates to your health. So that's how I view it. Like even like your daily habits, the things you like to do is all related to your mental health, related to your physical health, related to who
Mhm.
you are.
Okay. And so how do you personally like manage any health issues that you come across?
Well, I don't have any like serious concerns, but I do see my primary care physician once a year. And then if I ever get sick, like usually I feel like especially after COVID, like if I get sick, even if it's just like a sinus infection, I'll go and test for everything. Because for me, whenever I got COVID, it was a sinus infection. So it's like, so now every time I do get sick, I'll go to my primary care. And
Okay.
or if you have just like other concerns, like yeah, like things that come up, like
Okay. And then do you like what's your view of kind of like taking medicines or like supplement use
I think
or
I am okay with prescribed medicine, but I always do my research before I do over the counter, just because I feel like there are certain things that can make your symptoms worse, even though the over the counter stuff says it'll like relieve the symptoms. So I do my research before taking anything over the counter.
okay. And then what about like any alternative therapies?
Um, like by alternative,
Like
do you mean?
for like maybe like turmeric. I know in Indian
Oh,
culture it's
okay.
like
Yeah.
okay, instead of taking a medicine, drink like turmeric milk or
Oh, yeah, definitely I do
yeah.
that. Like, every time I have like a stomach issue or if I'm like nauseous, I will immediately do like lemon, turmeric, ginger,
Yeah.
and like
Yeah.
all my symptoms will go away. So I always do that.
Mhm. Yeah, so like that is like your go-to. Would you say that that's your go-to before turning to like over-the-counter medicines?
Yes, for sure.
Okay. Um, Alrighty. And then because due to your culture, does that affect how you like foods that you eat or exercises that you do?
Like, does my culture impact the foods I eat or exercises
Yes.
I do? Ye-
Hmm.
Yes, kind of. Like, I don't think, like, since I'm Christian, we don't really have a lot of food restrictions.
Hmm.
So I don't think, in terms of food, it affects it as much. Though I think it does make me more prone to avoiding like fried foods or like foods that I don't commonly eat in my culture, just because that's what I'm used to. And also
Hmm.
like exercise methods, like I just am more drawn to yoga than I would be to like running a marathon, just
Okay.
because it's more prevalent in my culture to do yoga than to go running a marathon.
Okay. And then what can you talk a little bit about what your family does to address their health issues?
My mom works at Emory, so she actually gets like a gym subscription for discounted price. So she's actually recently started going to the gym right after work. Um, she'll also go on walks with her friends, and same with my brother. He he likes to go on a lot of walks outside. My sister's kind of on and off about exercising, but she tries to find like hobbies that she likes,
Mhm.
like rock climbing.
All right. And like, what about like treating disease? How would they kind of go about that? Like, from a cold or like anything, a cough?
Mhm. I would say they would definitely do like traditional things first, like using steam or like turmeric and honey or like just foods that are known to have good immune benefits before turning to like the pills or over-the-counter medications.
Mhm. Um, Alrighty. And then are there any beliefs that affect your choice of health remedies? Um, just like, does your culture or religion like factor in to like what you would choose?
I'm trying to think of something.
Mhm.
Well, are there any beliefs that affect your choice of health remedies? Um, like I don't personally practice, but I know my mom's whole side of the family is Catholic. So I think like instead of like using birth control, they would just got their tubes tied after they stopped having, or once they wanted to stop having kids.
Mhm.
So it was, I guess that was like their what they did for birth control rather than take an actual pill or anything.
Okay.
But yeah, I don't think I personally really like don't do anything because of a belief or a culture.
Alrighty. So thank you so much for sitting down and doing the interview with me today. Um,
Of course.
Thank you for your time. Do you have any questions for me?
Um, okay, good.
Right, okay. So, for a quick summary of my interview, I interviewed Miss Jennifer Saj, who was 26 years old, and she is currently a third year student at Georgia State's occupational therapy program. She was initially born in Kerala, India, and moved to the US when she was 2 years old. And her religion is Christianity. Her spoken language is English, and her parents and grandparents speak Malayalam. In her culture, it is common to live in multi generational homes, and education is considered very important. So, her worldview of health is that she has a very holistic view, and for her, that means daily habits impact mental and physical health. And it's important to note that she does work in healthcare, and her mom is also a nurse, so that does influence her views of the healthcare system. So her personal view of health is that she does visit her PCP yearly and as needed for health concerns, but she does prefer to use alternative therapies first, like ginger and lemon, before turning to over-the-counter or prescription medicines. And her culture doesn't have any restrictions for like treatment options or any food restrictions, and so therefore she's pretty open with her healthcare um, treatment. And then for her family's view of health, they also prefer traditional remedies first before going to more invasive procedures. And they also like to keep an active lifestyle by going to the gym, walking, doing rock climbing. And Jennifer also mentioned that she likes her culture influences her habits, such as she would rather do yoga over like running. So, like, that's some influence that she has over her healthcare habits. Thanks.